Welcome back to another video. This one is on patellofemoral pain. I'm going to show you our two most common taping techniques for kneecap pain, which is a really common thing. In fact, perhaps the most common thing that presents to physiotherapy clinics like ours around Australia. So if you come in and have a little look here, we've got a knee here that's a little grumpy at the moment. And we know that the diagnosis is patellofemoral pain syndrome. So we've got irritation of the kneecap here. And we're going to test out which of these two taping techniques is most effective. So first of all, I really like to start off with a test to see if it's actually painful with a number. So what I'll get you to do, Sam, is drop down into a single leg squat on the right side. Okay, great. Now, just give me a score out of 10. 0, no pain. 10 is excruciating. Where was that?
Maybe a 6.
6. Okay, so we've got some pain on that. It's always good to test that out first. So I'll get you to lie back down again. We'll start with perhaps the most common taping technique that's been around for a long time. Really famous physio, Jenny McConnell, came up with this. Hence, it's commonly called the McConnell taping technique. We're going to use some under tape here. Okay, the first thing we're going to do here is find the edge of the kneecap. So we find the top of the kneecap, the bottom, and the lateral edge, which is around here. We apply the tape just to the outside of the edge. You can see I've captured that there. Now we've got a nice little anchor there. I'm going to pull a little bit of tension across, use the thumb to help stabilize it, and then just grab the skin there so we create a little fold. That's really important. Okay, a little fold like so. All right, you can see we call those knee creases that are in here. We've got two nice knee creases in there, and that just shows that we've got a bit of tension. Then we're going to use rigid tape over the top. This is 38mm rigid sports tape. And this just provides a little bit more support. Okay, so we go inside here. I've actually made that a little too long, so we'll trim that up. Okay, so we put the tape over the top here. Same thing, a little bit of tension on there. And there you have it. That's McConnell knee taping. I like to hold either side there, and I'll get the patient just to bend up. I know it pulls a bit. Okay, it's supposed to do that and pull up again. Okay, great. All right, can we retest that single leg squat and see what you think of that one? So I'll stand you back up. Same thing again, facing this direction into a single leg squat.
Yeah, much better. 4 out of 10.
Perfect, good. Okay, so we've got a 6 down to a 4. Let's compare that to the next one. So I'll get your legs back up there. Great. So that one of the downsides of that particular taping technique is it does come off quite easily. So often if we were putting this on for a sporting application, we would leave it like that, but put something over the top, some sort of stretchy tape or even a little wrap. And that helps keep it on for longer. But we're going to take that off now. It hasn't been on for too long. And sorry about that. We're going to peel that off as gently as I can. Okay, now we're going to use one of my other favorite techniques. We're using RockTape for this, or K-tape. I've already cut a couple of strips here. Okay, we fold this one in half. Make a little cut in here. Now there's lots of different techniques that you can use to get the same outcome. These are the ones that we use commonly in the clinic. We've created a little slit in the middle. Okay, and we apply the tape at the top there. All right, now we go around the kneecap. So just going to bend that kneecap up a little bit. Thank you, good. And we come in around the kneecap like so. Okay, and back down again. Good, and I like to have this obliquely across here. Why? Because we know with not all, but most patellofemoral issues, we want to actually take the kneecap from lateral to medial. So a slightly oblique angle tends to be more effective. Okay, part 2. Second piece of tape. All right, this is the really important one. We start laterally. Remember we just said before that we generally want to take the kneecap lateral to medial. So we're going to pull this piece around the kneecap like so, A little bit of tension across, and then just lay them over the top like so. All right, now what we've created is a little bit of a lateral buttress here, where there's pressure on the outside of the kneecap, and that provides a little bit of stability and resistance there. And typically we find that quite effective for helping offload that kneecap. Can we test that out again? And now we'll see which one the winner is. Which one did you like better?
I think the first one more supportive, but this one also feels good.
Score out of 10?
Ooh. In pain?
Have another go. In pain. Yeah.
Pain. Not as much pain.
Score. The last one was a 4.
This one's a 2.
2. Okay, great. So we have a clear winner. We've gone from 6 out of 10 on our single leg squat to 2 out of 10 using the RockTape. So that's a clear winner. Test both of those out for yourself. If you haven't subscribed, please do so. It really helps the channel, and we'll be able to continue to produce helpful content like this. Thanks for watching, and we'll see you in the next one.